Welcome to the Wellness Show. I'm Dr. Keisha Christian, your host, and so thankful that you've joined us for this episode. As we continue our 2018 journey into wellness, we have brought to you an excellent episode. Our episode today is going to be smoking cessation. Simply put, quit smoking. And we have a special guest that we will also share with you later in the show. But first, I want to talk a little bit about smoking. Smoking and secondhand smoking is very, very unhealthy for the general population. It can cause a lot of medical illnesses, it can cause diseases, and makes it uncomfortable for you to live a life that's wellness. Let's share with you why smoking cigarettes are unhealthy for you. One of the major reasons is that it has an abundance of chemicals that the nicotine is composed of. It's composed of at least 600 chemicals, and at least 69 of those chemicals are carcinogens. So it can cause a lot of medical conditions, as I mentioned, both externally and internally for a person. Let's talk about the external surface of our bodies. It can cause premature balding and loss of hair. It can cause damage to the nails and nail beds, and it can cause a lot of problems with the skin because of the decrease in circulation throughout the body that nicotine has on the body. Internally, it can cause cataracts in the eyes, which is blurring of the lens, so it can cause difficulty with seeing. It can cause macular degeneration of the eyes, so it leads to blindness. It can cause gum and teeth disease and cancer. It can also cause cancer in the digestive tract, the esophagus. It can cause cancer in the pancreas. It can also cause lots of conditions as well as cancer in the lungs. Did you know that 90% of smokers have lung cancer? And it can also cause medical conditions such as chronic obstructive pulmonary disease. Many of you may know it as COPD, and that is emphysema as well as bronchitis, and those two conditions coupled together, basically it makes it difficult for someone to breathe. So you may require oxygen or even breathing treatments. Some other conditions that are concerns for smokers are heart disease, diabetes. It can cause infertility. It can cause rheumatoid arthritis and also inflammation throughout the body. And I just want to mention also that smoking is the leading preventative cause of death. 480,000 people die annually from smoking. So we want you to embrace wellness and hopefully decide to quit smoking. So we have invited a special guest today. She is native of North Carolina. She is over 25 years of counseling on this subject matter, and she has her own clinic called Stop Clinic here in Cary, North Carolina. So without further ado, I introduce to you and welcome Leslie Lyon. Leslie, so glad that you have joined us today. Thank you for coming on to our show today. We're so excited to hear about all the knowledge that you have to share with us about quit smoking. So thank you so much. But first we want to get a chance to know you. And you're very experienced in this area of smoking cessation. Share with us what motivated and inspired you to get in this industry.
Okay, before I worked with the addictions, I worked in a chronic pain clinic.
Oh, okay.
Which I totally love that, but I love working with the addictions more. One day the owner of the clinic came to me and said, you know, there's a real need for smoking cessation in our area. We don't really have that much. And he said, I think you should start a program. So we started working on the program, and then 6 months later we started offering it to the public. When I was about probably in my 30s, I was thinking one day, what do I want to do when I retire? And I thought, what I would really like to do is I'd like to have a comfortable setting and invite people in and help them work on their problems.
I love that.
Yeah, then I started thinking, well, if I think that's so much fun now, why don't I just go ahead and do it now?
Right, absolutely.
So I've been blessed with a career that I can just invite people in, help them with their addictions, and see their progress of wellness.
That is great. I love that. That sounds like it's a passion of yours to help people, and it's very inviting here in your office and very comfortable. So I love that anyone that walks in, you feel like you're at home. You feel like you can engage with you, talk to you openly and freely, and also get lots of recommendations, suggestions, advice on how we can quit the smoking habit. So yes, absolutely. We thank you for being here.
Thank you. Thank you.
Yes. So share with us what factors, personalities, and behaviors make it difficult for smokers to stop smoking.
Well, as you've said before, and nicotine is a very powerful addiction. It's hard to give it up. It's really hard. A lot of people who use drugs are suppressing emotional feelings.
Okay.
Sometimes they're suppressing pain, and it makes it very difficult to give it up. When we're kids and we start smoking, a lot of us have played around with it. It's a very fashionable thing to do. And then when we get older and we're hooked on it, it's really hard to give it up.
Sure.
For some people, it's still fashionable. They really enjoy it. And some people are in a state of denial, thinking that it's not really hurting them.
Okay.
And they don't really want to give it up until they are diagnosed with some horrible disease. That's sad but true.
That's unfortunate. That is really unfortunate. Now, are there any other drugs that smokers use to help maintain their nicotine habit?
A lot of smokers have a really bad habit of skipping meals.
Okay.
So they're using food as an addiction
Okay.
as well.
Okay.
So a lot of times I hear people say, I go all day and I don't eat. I only have one meal a day, and that's at night.
So they actually think that that is healthier for them?
I don't know if they think it's healthier,
Okay.
but they're kind of almost proud of it.
Okay.
That they can go all day without eating. But the other drug, in answer to your question, the other drug they're using is usually sugar, caffeine,
Okay.
and those are drugs as well.
Okay. Okay. So they're drugs to help make you feel better or change how you feel. Is that correct? Is that why
They do help you feel better
Yes.
immediately, but not long term.
Right.
And then if you are using the nicotine to suppress your appetite, then you're often malnourished. Because the body cannot be healthy and go all day without food.
Right. Absolutely.
Yeah. Caffeine, nicotine, and sugar are not real food.
Right. Can you share with us some behavioral modifications that smokers would benefit from in helping them quit the nicotine habit?
Yes. When a person contacts me and asks me if they want, they'll come and they want to stop smoking, and they contact me, and the first contact is by phone. And after talking to them for a little while, I'll know whether I can commit to working with them. And if they have a real desire to stop smoking, then I really am easily able to help them.
Okay.
When they sign up for the program, the first thing I do is send them behavior modification exercises.
Oh, good.
Yes. These are designed to help them reduce their cigarette smoking, to address the mental part of the addiction, which is at least 50%,
Okay.
and begin the detox process. Everything that we do is based on rapid drug detox.
Interesting.
Yes. One of the biggest suggestions that I have for a person that's trying to give up the habit is to replace the void with nutritious food. So we ask that they increase their fruit, their vegetable, and their water intake, because this is going to help tremendously with the detox process.
Absolutely. I love that.
Yes. And if they do that, if they adhere to those suggestions, it makes it just easy, so easy for them to stop smoking.
Absolutely. And I think that it's a challenge for people because sometimes it takes a little time to feed your body with good, nutritious foods and to see progress.
Yes.
And you want instant gratification, but that is maybe down the road a little bit, but when it happens, that instant gratification from eating healthier, exercising, and quitting the smoking habit, you feel great.
Yes.
And you have the capability of feeling great every day.
Yes, and sometimes it's being willing to make these changes. Because think about it, if you have someone that only eats 1 meal a day, and then you're asking them to eat a little bit frequently,
Sure.
that's a hard change for them.
Sure.
But then, as you say, once they make that change, they can't believe how much better they feel. They come in on their second visit, and that's one of the first things out of their mouth.
And that's great because, of course, they can always prevent a lot of the medical risks
Yes.
that they are susceptible because they're quitting smoking.
Yes.
So that is great. And then, of course, they're becoming healthier nutrition-wise and exercise-wise. So I love that. I
Right.
love that. Interesting.
Sometimes people even come in to work on the smoking cessation, and they start feeling so much better. They want to work on like a checklist of other problems that they're having.
Absolutely.
That they
That's
can cure
great.
with food.
Oh, wow. Interesting. And you can help them with that as well. They can confide in you, you know, and you can help them not only with the smoking cessation, but the other aspects.
Yes.
Because like you said, it's behavioral. It may stem from, their habit may stem from some other issues that they may be encounter or they may be thinking of. And so that's good that you're a cure-all. You can help them with everything.
They're willing, only if they're willing. Yes.
Absolutely.
But it gives the person the control.
Absolutely.
You know, and once they start having a better diet and they feel in control, they're more likely to adhere to that process.
Sure, definitely understandable. So what are some of their motivational factors to stop smoking, even before they pick up the phone to call you or make an appointment with you?
Yes. Sadly, a huge motivator is being diagnosed with some horrible disease. COPD is a real scary one, emphysema is scary. Heart disease is scary. A surgery, some surgeons that refer to us won't even work on the people as long as they're smoking, so they have to stop smoking.
Right.
Well, one of the best motivators is a new grandchild.
Oh, wow. Okay. The beautiful presence of a new life.
Yes.
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 Okay, interesting.
It is.
Huh, I never thought of that. That is interesting. Yes, and you know, we're going to address both of what you said, the motivating factors. Some of the motivating factors are, you know, as a physical therapist, I see a lot of clients, and quite a few clients are also smokers, and I have recommended and suggested for them to quit smoking, and if not, then of course try to decrease their consumption of cigarettes, because with smoking, that slows down or hampers the healing process.
Yes.
So as they have an injury or some medical condition that I'm treating them for, or any other healthcare provider is treating them for, it makes the process of healing that much more difficult and longer that they have to experience. So I can understand some doctors will not actually work with them or actually treat them until they're stopped, because what we do may not be 100% beneficial until they stop smoking. We want to have and want them to have successful outcomes, and for them to be completely rid of that medical condition,
Right.
that disease, that injury. And I think when you stop smoking or decrease the amount of consumption, it makes it a lot easier to heal from
It
various
does.
ailments.
And I've also found that most people that come to see me
Mhm.
that are in pain are simply dehydrated.
Yes. Yes.
That's terrible, but
It
and
is.
it's such a simple fix.
It is. It really is. And it goes back to that nicotine, that component of nicotine. It has so many chemicals that are very harmful
Mhm.
for our bodies. And it does so many things to various systems within our body. And it depletes that water within our body. And then for smokers, they may not have the desire to drink as much water to replenish it. So yes, it's interesting how many systems throughout the body can be impacted, and unfortunately, sometimes it's not until they are advised from a healthcare advisor to go ahead and quit smoking that they may, realize that, I need to make a change, or the presence of a grandchild that they really realize that, I need to make a change. Yeah, and we want everyone to be healthier. We're starting, as I shared, 2018 is people being healthier and living a life of wellness. And
Yes.
one of the most important is smoking cessation, is to stop smoking and live a life of wellness and feed your body with good, nutritious food, information, pleasant thoughts, and just having peace. That makes a big difference as well.
Definitely.
So, as I mentioned earlier, is secondhand smoke is also harmful. And unfortunately, there are family members and friends who are subject to secondhand smoke because they are around their loved one who smokes. How can a family, friend, acquaintance, coworker support and encourage their loved one and to stop smoking?
First thing you have to do is plant the seed. And then don't drown it.
Right.
Too much information, too much nagging, that's drowning the seed that
Okay.
you planted. The people who have a strong support system have an easier time stopping.
Okay.
Some people, it's sad to say, have no support system. It makes it very difficult for them to stop. And I'm often amazed at the people that come in that do not have a support system.
Sure. Oh, that's too bad.
Yeah, but some people come in and they have a spouse that smokes. That's hard too.
Sure.
Yeah, because the spouse wants to support you, but they don't always know how to support
Right.
you.
Right.
So I tell them, I say, go home, ask your spouse to not smoke around you. Don't lay the cigarettes around, don't have them around you. And then that will help you more than anything. Not everybody wants to be reminded of it, and sometimes they'll say, don't ask me, just don't ask me. It's almost like you don't think about it, it's not a real thing.
Sure.
Some people want to be encouraged, so you have to know how that person really responds to positive
Sure.
reinforcement.
Absolutely. That makes
Yeah.
sense. That makes sense. So you want to plant that seed, and then depending on the person and the personality, depends on how you continue down that road of encouraging them to stop smoking.
Right.
Yeah. And studies have shown that having great supporter and a counselor or therapist increases the chance for success in someone to quit smoking.
Yes.
So coming to see Leslie definitely increases that chance of success. So I can imagine that, and then also having the support structure at home,
Yes.
or at your job, or wherever you may be, helps as well. And there are a lot of wellness programs with corporations that also have smoking cessation information that they send out as well.
Yes,
So
that's
that's
good.
good. Yes.
Yes.
It's always good to get valuable information to help us become healthier and live a life of wellness.
Yes.
So if you feel that, I've been smoking for so many years, X amount of years, and I just can't stop, it is never, ever too late for you to stop. If you stop, you can rebound and renew your body and ward yourself from various medical conditions, diseases, and you can live a life of wellness. If you need a specialist like Leslie, please contact her. She's at Stop Clinic in Cary, North Carolina, or pick up the phone and give her a call. So Leslie, if you can share with us what a first visit would be like for someone who wants to quit smoking.
Okay. When you first come in, I give you a relaxation treatment, which is very nice. And then we start talking. I read the patient information form, and I see all the problems, and if there's extra things you're working on, then we'll do the counseling session. And then I give the treatment, which is similar to acupuncture.
Oh,
It blocks the cravings, so they don't have the cravings or the withdrawals. Most people go home, some people fall asleep during the treatment because it is so relaxing.
Sure.
And then most people go home and they want to take a really long nap. Yes.
Sure, that's good.
Yes, and then I'll have the client come back in 3 or 4 days, and we'll do a reinforcement treatment. And then we'll do one more visit after that to make sure that they're 100% successful.
Okay, so did you say 4 visits?
It depends on the person. Sometimes we give 3 visits, sometimes we give 5 visits. Most people are fine with 3 visits.
Okay, excellent. So,
Yes.
see, before I met with you, I thought it was longer, and I know everyone is different, so it may depend, but I thought it would be a course of maybe weeks.
No.
So, yeah,
No,
weeks or even months. So.
Yes, everything we do is based on rapid drug detox.
Okay,
Yes.
excellent. So that is good to know,
Yes.
that it will only take a few visits, plus or minus, depending on the person,
Yes.
that will help them to stop smoking.
Yes, and if people come in from out of state, I'll see them 3 days in a row,
Okay,
or out of state, out of country,
sure.
and they're just as successful.
Excellent.
It depends on the program. If people come in and they want to work on their food and weight loss, then that will be probably 5 visits. And then sometimes people want to continue their program, and they
Sure.
might come for 2 or 3 months, depending on what they're working on.
Excellent.
Yeah, so we have a lot of different programs.
Wow, that's great. And so I understand that you help people locally in Cary and the Triangle area, all throughout North Carolina, and people that come from different states and countries.
In countries, yes.
Excellent. So you are providing a Class A service here that allows people to get comfortable, but also helps them to quit their smoking habit.
Yeah.
Thank you for being here.
Thank you.
Yes, and
Yes.
if you need Leslie's services, like I said, check out her website at Stop Clinic. She is wonderful. I love her already. She's wonderful, and like she said, it can take 3 or 4 visits to help you to stop smoking so that you can have a quality of life. And that's what we want. We want and wish for you to have a quality life. So again, Leslie, thank you for joining us today
Yes,
on the
thank you too,
Wellness
Keisha.
Show.
Yes,
You
thank
have
you.
been wonderful in providing a wealth of information. You've
Good.
enlightened me. So thank you for the information. I will certainly share that with other people. And if you're a smoker and you need the services, certainly go to Leslie's website. But if you have a loved one as well, or a family member or coworker or acquaintance, someone that you know that is a smoker and would benefit from these services, please, you can also even pick up the phone and call Leslie, and she can give you some information and point that person that needs her services in the right direction. So again, thank you for watching the Wellness Show. We wish for you a year full of wellness. So please start today, quit smoking, and we hope that your loved one also quits smoking, and most of all, be well.